Hello all, I'm Dr. Neema Bhat, Hematologist, bone marrow transplant physician, and Pediatric Oncologist. Today I'd like to talk about leukemia and what are the myths associated with leukemia, especially in children, leukemia and other cancers in children. So I've spoken about what are the most common cancers in childhood, how we treat it, but it's also important for the general public to know what to not believe, because when you find a patient with the diagnosis of leukemia and you go out in the community and talk about it with relatives, with friends, you are going to be asked 100 questions. 100 people are going to raise 100 questions. They are going to give 100 suggestions. Each person is going to direct you to a different doctor and probably say this is what is best for your child right now. So, what you need to do at this moment when your child is diagnosed with any type of cancer is first to understand what are the correct things and what are the things that should not be done, or what are the wrong things that are sort of afloat in the community about pediatric cancer or cancer in children. One of the most common things I have heard is children with cancer cannot tolerate chemotherapy. So, has been branded or has been labeled as this very dangerous mode of treatment or therapy, which cannot be tolerated by children just because they're very tiny and they will have a lot of side effects from it, and it should not be given to children. I agree, chemotherapy should not be given to children as regular treatment, but for a child with cancer, chemotherapy is the only way that you have a chance at curing a child with cancer. So, yes, it can cause side effects in children, but for curing cancer, chemotherapy is the only way to cure it. Even though it comes with side effects, if you approach the right kind of consultant or specialist who has experience in dealing with children who have cancers, we make sure to give the correct adjusted doses for a child's particular weight or their bodily functions, their organ functions, and only then make sure to deliver the chemotherapy. We also at baseline make sure that we check the heart functions, we check the liver functions, kidney functions, and only then start to plan the chemotherapy doses or courses for children. One of the other myths I've heard is chemotherapy side effects alone can kill children. As I mentioned in my previous sentence, yes, chemotherapy side effects can be pretty significant. They can cause you to drop counts. They can reduce your immunity, which means they can increase your risk for infections. It can make you anemic. It can drop your platelet counts. But these are mostly side effects that are seen with chemotherapy, whether it is in adults or in children. And without these side effects, chemotherapy cannot be delivered. But at the same time, we have to remember that these are important medicines that we use to kill cancer. And without these medicines, cancer cannot be conquered. Another myth, so myth number 3 I've heard is cancer can spread to others. So if, say, one child in the family has cancer, the child goes to school, this cancer can spread to other children in the class or other children in the community. So other children can be prevented from playing with this child who has a diagnosis of cancer. This is an absolute myth and should absolutely be addressed in the right way. Cancer is not a disease that spreads from one person to another person like a cold or a cough or a viral infection. This is something that happens when the DNA changes in our body. We call it genetic mutations, and these lead to a series of events that then causes the individual to have cancer and has nothing related to being exposed to another person or child who has cancer. Myth number 4, all pediatric cancers or all childhood cancers are hereditary. So, only if somebody else in the family has a particular type of cancer, only then another child, a child is at risk for developing a cancer. This is an absolute myth. So, we know that most of the adult cancers are associated with lifestyle. It can be smoking, it can be consumption of very heavy amounts of red meat, it can be alcohol consumption. So most of the adult cancers are related to these lifestyle factors. Whereas most pediatric cancers, yes, they come because of genetic mutations, but it does not mean that somebody in the family should always have a cancer for a child to get a cancer. So that is an absolute myth. The genetic mutation can happen even if there is no other family member who has a cancer. It can be what we call a de novo mutation, which means it can be a new change in the genes that can cause this child to have cancer. And one last myth, an absolutely important myth that as a pediatric oncologist I have to tell to the community is, once a child is cured of cancer, there is no further need of follow-up. So this is something that you have to remember. Cancer, just like in the adults, can recur, in which case it is called a relapse, even in children. So even if a child has been cured of cancer at that particular point, it's very important for a child to go back for follow-up or what we call surveillance, with a pediatric oncologist, because we know exactly what are the side effects to look for in a cancer survivor. And this follow-up has to be very regular. Initially it is once every month, once every 3 months, once every 6 months. So we follow particular schedules and space out the surveillance or follow-ups. But definitely every child who has been cured of cancer also requires at least once a year or annual follow-up with a pediatric oncologist, even in spite of being cleared of cancer, because there is a very high risk of either the same cancer coming back or other cancers related to the treatment of the first cancer coming back. So you have to remember that not only is it important to know things or be aware of pediatric cancer, it's also important for you to remember what are the wrong things or wrong ideas that are prevalent in the community and should not be given heed to. But the right advice has to be followed for the best care for a child with cancer. If you have any questions regarding children with cancer, please reach out to me. I'm Dr. Neema Bhat, Pediatric Oncologist at Helios Hematology and Cancer Clinics. Thank you.